In late 2016, the U.S. Department of Housing and Urban Development announced that public housing developments in the U.S. would be required to provide a smoke-free environment for their residents. The effective date for their final rule was February 3, 2017, and it required thousands of public housing agencies to implement smoke-free policies by July 31, 2018. According to the final rule summary, posted in the Federal Register, each public housing agency must implement a smoke-free policy banning the use of prohibited tobacco products in all public housing living units, indoor common areas in public housing, and in public housing agency administrative office buildings. The smoke-free policy must also extend to all outdoor areas up to 25 feet from the public housing and administrative office buildings. This rule improves indoor air quality in the housing, benefits the health of public housing residents, visitors, and public housing agency staff, reduces the risk of catastrophic fires, and lowers overall maintenance costs. Regarding the need for this smoke-free rule, the Centers for Disease Control and Prevention had stated the following. In buildings that have multiple housing units, secondhand smoke can move from unit to unit through hallways, stairwells, heating and air conditioning systems, and other ways. More than 1 in 3 non-smokers who live in rental housing are exposed to secondhand smoke, and many who live in public housing are especially vulnerable to the effects of secondhand smoke, including children, the elderly, and people with disabilities. Minimizing exposure to secondhand smoke is important, as the U.S. Environmental Protection Agency classified it as a Class A known carcinogen back in 1992. In 2006, the U.S. Surgeon General concluded that there is no risk-free level of exposure to secondhand smoke. According to the CDC, nationwide, secondhand smoke exposure contributes to approximately 41,000 deaths among non-smoking adults and 400 deaths in infants each year. Secondhand smoke causes stroke, lung cancer, and coronary heart disease in adults. Children who are exposed to secondhand smoke are at increased risk for sudden infant death syndrome, acute respiratory infections, middle ear disease, more severe asthma, respiratory symptoms, and slowed lung growth. These are just a few things to know about HUD's smoke-free public housing final rule. To learn more about tobacco smoke and other indoor air quality, environmental health, or safety issues, please visit the website shown on the screen.
IAQ TV, the place to be.